Hi friends, let's study aggressive periodontitis. Already we have made a video of chronic periodontitis. Actually, this is an old concept. In recent times, this aggressive periodontitis also we see other bacteria present, not a specific microorganism. So the 2017 classification, the difference between the aggressive and chronic has been blurred out and clubbed under the single term periodontitis. Okay, but now we have to understand what is aggressive periodontitis. Periodontitis is the inflammation of the supporting periodontal tissues surrounding the tooth. Aggressive means the form is too aggressive. That means there is a rapid destruction of the periodontium. This is basically the aggressive periodontitis. We have to see some of the characteristics of this AP, aggressive periodontitis. That means it's a rare disease usually seen in a puberty age, like the young adolescents or young individuals. In these patients, there will be no or minimal plaque accumulation, but the destruction would be too much. Moreover, the patient is healthy and they would not be having any systemic disease or anything, but there is a rapid destruction of this periodontal tissues. Okay, so here the attachment loss and bone loss also would be too much. Attachment loss would be restricted to incisor and molars. Bone loss rate is 2 to 3 times faster than the chronic periodontitis. You can imagine how aggressive is this disease. Other than that, these patients would we can see the diastema, because the teeth would be mobile and migration of the teeth will occur. So these all are the main characteristics of this aggressive periodontitis. Now we have to understand how they classify this aggressive periodontitis AP. Okay, so it is classified into localized and generalized. Localized means the destruction is localized to incisors and molars. Why it is like that? Why it is not affecting other teeth? Because these two are the first permanent teeth to erupt at the age of 6 to 7 years. At the age of 6 to 7 years, the host immune response is not that much strong in a child. As this AA means this is one of the main causative microorganisms in this AP. AA means the microorganism name is Aggregatibacter actinomycetum comitans. Okay, this AA is the major one of the major microorganisms present in AP. As this AA progresses to other sites, the age of the child also increases. So the child would get a more stronger immune response. So that's why it is not going to spread to other areas. After the initial reaction, this you have to understand. After the initial reaction, individuals' immune response to these microorganisms would be very high. So they stimulate more neutrophils and macrophages to the site. They are the first line of defense, and they produce immunoglobulins and phagocyte the bacteria and decrease this AA activity. So that's why in localized aggressive periodontitis we see more serum antibodies, because they produce more antibodies to fight against this bacteria, whereas after few years it will spread. Means after few years what will happen is that the child immune response would be getting more stronger, so they don't need to release lot of antibodies against that. So the serum antibody response to AA would be very poor in generalized AP. We have to say that this disease is generalized means definitely there would be at least 3 teeth affected apart from the incisor and molars. The interproximal attachment loss should be present at least 3 teeth. Other than that, incisor and molars. That is really important. So what all are the features of the in generalized aggressive periodontitis? We see some clinical features, like it can be seen in younger than 30 years of age. Here also plaque accumulation would be very minimal, and other than incisor and molar, 3 teeth has to be affected. Then here also no systemic diseases, tooth mobility, everything can be seen in general. generalized aggressive periodontitis. Then we have to see how it spread. What is the pathogenesis of this aggressive periodontitis? Okay, for the aggressive periodontitis to manifest, at least two requirements are present. One is highly virulent organism must be present to cause the disease. Other is the susceptibility of the individual. Then we have to see which all are the virulent factors of this aggressive periodontitis. One is the microbiological factor. This aggregative factor actinomycetum comitans microorganism has certain virulent factors. One is like leukotoxin. This leads to the destruction of the macrophages and the neutrophils. And the bacteriocin, this inhibit the useful beneficial species into the host. Other is the collagenase. This degrade the collagen. And the immunosuppressive features, like it inhibit the immunoglobulin, so this cannot cause the phagocytosis. Other virulent factor is the chemotactic inhibiting factor. This inhibit the chemotaxis of neutrophils. So these all are the virulent factors of this AA. So just imagine how strong this AA is. Okay, then the other immunological factor, that means it is a response, immune response of the host. Some patients, they have this defective chemotaxis due to the functional defect of neutrophils. Other than that, they have some patients, they have hyper responsive monocyte. If that is the case, we know if the monocyte responds more, they release lot of prostaglandins and interleukins. We already heard that this interleukins that causes